Hello everyone, I'm Dr. Harrington, and today I need to share something with you that could save your hearing and potentially prevent irreversible damage that millions of seniors are unknowingly inflicting on themselves every single day. There's a medication that most of you probably have in your medicine cabinet right now, something so common and seemingly harmless that you might take it without a second thought. But new research reveals this everyday painkiller is silently stealing your hearing, and the effects can be permanent. I'm talking about ibuprofen, and before you dismiss this as just another scare story, let me tell you about what happened to one of my patients last year. Frank Rodriguez, a 72-year-old retired mechanic, came to see me complaining about what he thought was earwax buildup. He'd been having trouble hearing his wife, kept asking people to repeat themselves, and had started turning the television volume up so loud that his neighbors were complaining. Frank had been taking ibuprofen daily for over 3 years to manage arthritis pain in his knees and back. His previous doctor had told him it was safe for long-term use, and Frank never questioned it. After all, ibuprofen is available over the counter. It's been around for decades, and millions of people take it regularly without obvious problems. But when I examined Frank and reviewed his medication history, I immediately suspected his hearing loss wasn't from earwax. It was from his daily ibuprofen habit. Comprehensive hearing tests confirmed my suspicion. Frank had developed significant sensorineural hearing loss, the permanent type that occurs when the delicate hair cells in your inner ear are damaged. The pattern of his hearing loss was exactly what we see with medication-induced ototoxicity, damage to your hearing caused by drugs. Most tragically, this damage was completely preventable. What Frank didn't know, and what most seniors don't realize, is that regular use of NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, and aspirin, can cause serious hearing problems. A groundbreaking study published in the American Journal of Epidemiology followed over 26,000 men for 18 years and found that regular users of ibuprofen had a 24% higher risk of hearing loss. For those who used it 6 or more days per week, the risk jumped to an alarming 33% increase. But the story gets even more concerning when we look specifically at older adults. A separate study focusing on people over 60 found that seniors who used NSAIDs regularly were nearly 45% more likely to develop significant hearing loss compared to those who rarely used these medications. Think about that statistic for a moment. We're talking about nearly a 50% increased risk for something as fundamental as your ability to hear. Here's what's happening inside your ears when you take these medications regularly. Your inner ear contains thousands of tiny hair cells that convert sound waves into electrical signals your brain can interpret. These hair cells are incredibly delicate and have virtually no ability to regenerate once damaged. NSAIDs appear to reduce blood flow to these critical structures and may directly damage them through toxic effects on cellular metabolism. The mechanism involves something called prostaglandins, which are hormone-like substances that help regulate inflammation, blood flow, and pain perception throughout your body. NSAIDs work by blocking the enzymes that produce prostaglandins, which is why they're effective for reducing pain and inflammation. However, prostaglandins also play crucial roles in maintaining healthy blood flow to your inner ear and protecting those delicate hair cells from damage. When you block prostaglandin production with NSAIDs, you inadvertently reduce blood flow to your inner ear. This creates a state of chronic oxygen and nutrient deprivation that can gradually damage or destroy hair cells over time. Unlike a cut on your skin that heals or a broken bone that mends, damaged hair cells in your inner ear are gone forever. Once they're destroyed, the hearing loss they cause is permanent. What makes this particularly insidious is that the damage typically develops gradually over months or years of regular use. You don't wake up one morning suddenly unable to hear. Instead, you might notice that you need to turn the television up a little louder or ask people to repeat themselves occasionally. These subtle changes are easy to attribute to normal aging or temporary issues like earwax, sinus problems, or seasonal allergies. By the time the hearing loss becomes obvious enough to prompt medical evaluation, significant permanent damage has often already occurred. Studies suggest that you might lose thousands of hair cells before you notice any hearing problems, because the human ear has remarkable redundancy built in. But once you cross that threshold where hearing loss becomes apparent, much of the damage is irreversible. The research on this connection has been building steadily over the past 2 decades. A major study from Harvard followed over 62,000 women for 14 years and found similar results to the male studies I mentioned earlier. Regular aspirin users had a 13% increased risk of hearing loss, while regular ibuprofen users had a 21% increased risk. Most significantly, the risk was dose-dependent, meaning the more frequently people used these medications, the higher their risk of hearing loss. What's particularly concerning is how common NSAID use has become among seniors. Studies indicate that over 30% of adults over 65 use NSAIDs regularly, often for chronic conditions like arthritis, back pain, or general aches and pains that come with aging. Many of these individuals have been using these medications for years, completely unaware of the potential impact on their hearing. The situation is made worse by the fact that many seniors take multiple medications that can affect hearing. Certain antibiotics, chemotherapy drugs, diuretics, and other medications can also cause hearing problems. When you combine regular NSAID use with other potentially ototoxic medications, the cumulative risk to your hearing can be substantial. Let me share another case that illustrates this perfectly. Dorothy Chen, a 68-year-old who came to see me about increasing hearing difficulties. She'd been taking ibuprofen 3 times daily for 2 years to manage fibromyalgia pain, plus she was on a diuretic for blood pressure, and had recently completed a course of antibiotics for a respiratory infection. She didn't connect any of these medications to her hearing problems because each one had been prescribed or recommended by different doctors for seemingly unrelated conditions. When I reviewed Dorothy's complete medication history and conducted hearing tests, it became clear that her hearing loss was likely the result of cumulative ototoxic effects from multiple medications. The ibuprofen was probably the biggest contributor due to its daily use over an extended period, but the other medications may have accelerated or worsened the damage. This highlights a crucial problem in our healthcare system: the compartmentalization of medical care. Your arthritis might be managed by a rheumatologist, your blood pressure by a cardiologist, your infections by your primary care doctor, and your hearing problems by an audiologist or ENT specialist. Unless someone is specifically looking at how all these treatments might interact and affect your hearing, the connection between your medications and your hearing loss might never be recognized. The tragedy is that in many cases, safer alternatives exist for managing the conditions that lead people to use NSAIDs regularly. For arthritis and chronic pain, options might include physical therapy, topical pain relievers, heat and cold therapy, gentle exercise, acupuncture, or other pain management strategies that don't carry the same risks to your hearing. If medications are necessary, there are sometimes alternatives that may be less likely to cause hearing problems. Acetaminophen, for example, hasn't been associated with the same hearing risks as NSAIDs, though it has other potential side effects that need to be considered. The key is working with healthcare providers who understand the full spectrum of risks and benefits for your individual situation. But here's what many people don't realize about hearing loss. It's not just about volume or the ability to hear sounds. Hearing loss, especially when it occurs gradually, can have profound effects on cognitive function, social relationships, mental health, and overall quality of life. Research has consistently shown that untreated hearing loss in seniors is associated with increased risk of dementia, depression, social isolation, and even falls and accidents. The connection between hearing loss and cognitive decline is particularly important for seniors to understand. Your brain relies on auditory input to maintain neural pathways involved in processing speech and environmental sounds. When hearing loss reduces this input, your brain has to work harder to interpret the limited auditory information it receives. This increased cognitive load can contribute to mental fatigue and may accelerate cognitive decline over time. Studies have found that even mild hearing loss doubles the risk of developing dementia, moderate hearing loss triples the risk, and severe hearing loss increases the risk by 5 times. While we can't definitively say that preventing medication-induced hearing loss will prevent dementia, protecting your hearing is certainly one modifiable risk factor that deserves serious attention. The social and emotional impacts of hearing loss can be equally devastating. People with hearing difficulties often begin avoiding social situations because conversation becomes difficult or embarrassing. They may stop participating in activities they previously enjoyed, withdraw from family gatherings, or become isolated from friends. This social isolation can lead to depression, anxiety, and a general decline in mental health and life satisfaction. So what can you do to protect your hearing if you currently use NSAIDs regularly or are considering using them? First, have an honest conversation with your healthcare provider about whether these medications are truly necessary for your situation. Discuss the risks and benefits, explore alternatives, and consider whether the potential hearing risks are worth the pain relief benefits you're receiving. If you must continue using NSAIDs, try to use the lowest effective dose for the shortest possible duration. Intermittent use appears to be much safer than daily, long-term use. Instead of taking ibuprofen every day as a preventive measure, consider using it only when you're experiencing significant pain that other measures haven't helped. Monitor your hearing carefully if you're using NSAIDs regularly. Pay attention to subtle changes like needing to turn up the television, asking people to repeat themselves more often, or having difficulty following conversations in noisy environments. These can be early signs of hearing problems that warrant immediate medical evaluation. Consider getting baseline hearing tests if you're going to use NSAIDs long-term. Having objective measurements of your hearing function can help detect changes early, before they become severe enough to significantly impact your daily life. Many insurance plans cover hearing evaluations, especially for seniors, and the tests are painless and relatively quick. Explore non-pharmaceutical approaches to pain management. Physical therapy, gentle exercise, heat and cold therapy, massage, acupuncture, and other complementary approaches can be remarkably effective for many types of chronic pain, often without the side effect risks associated with medications. If medications are necessary for pain management, work with your healthcare provider to find the safest options for your individual situation. This might involve trying different medications, adjusting doses, or using combination approaches that allow for lower doses of any single medication. Be especially cautious about combining multiple medications that might affect hearing. If you're taking NSAIDs along with diuretics, certain antibiotics, or other potentially ototoxic medications, make sure your healthcare providers are aware of all your medications and the potential for cumulative hearing risks. The good news is that stopping NSAIDs may prevent further hearing damage, even if it can't reverse damage that's already occurred. Some studies suggest that hearing function may stabilize or even show modest improvement after discontinuing these medications, though significant recovery of lost hearing is unfortunately rare. For people who have already developed hearing loss, whether from NSAIDs or other causes, the most important step is getting appropriate treatment. Modern hearing aids are far superior to devices from even a few years ago, and they can dramatically improve quality of life for people with hearing impairments. The key is getting fitted with appropriate devices and learning to use them effectively. There are also emerging treatments for hearing loss that may become available in the coming years. Research into hair cell regeneration, gene therapy, and other innovative approaches offers hope for people with sensorineural hearing loss. While these treatments are still experimental, they represent exciting possibilities for the future. Prevention, however, remains far better than any treatment. Protecting your hearing by making informed decisions about medication use is one of the most important steps you can take to preserve this crucial sense as you age. Let me share some specific strategies that can help you maintain your hearing health while still managing pain effectively. First, consider the timing and frequency of your NSAID use. Instead of taking these medications daily as a routine, try using them only when you're experiencing significant pain that interferes with your daily activities. This intermittent approach can provide pain relief when you need it most, while minimizing the cumulative exposure that leads to hearing damage. Second, explore topical alternatives when appropriate. Topical NSAIDs, like diclofenac gel or ibuprofen cream, can provide localized pain relief with much lower systemic absorption compared to oral medications. While some of the medication still enters your bloodstream, the levels are typically much lower than what you'd get from taking pills, potentially reducing the risk to your hearing. Third, consider the powerful role of lifestyle modifications in pain management. Regular, gentle exercise can be remarkably effective for managing arthritis pain and general aches. Activities like swimming, walking, yoga, or Tai Chi can improve joint mobility, strengthen supporting muscles, and release natural pain-fighting endorphins. Many of my patients have been able to significantly reduce their reliance on pain medications by incorporating consistent, appropriate exercise into their daily routines. Heat and cold therapy represent another underutilized tool for pain management. Warm baths, heating pads, or topical heat patches can help relax muscles and improve blood flow to painful areas. Cold therapy, using ice packs or cold compresses, can reduce inflammation and numb acute pain. These simple, safe approaches can often provide substantial relief without any medication risks. Stress management also plays a crucial role in pain perception and management. Chronic stress can amplify pain signals and make discomfort feel more intense. Techniques like deep breathing exercises, meditation, progressive muscle relaxation, or mindfulness practices can help break the cycle of stress and pain. Many seniors find that dedicating just 10 to 15 minutes daily to stress reduction techniques can meaningfully improve their pain levels and overall well-being. Sleep quality is another often overlooked factor in pain management. Poor sleep can significantly increase pain sensitivity, while chronic pain can disrupt sleep, creating a vicious cycle. Establishing good sleep hygiene, maintaining consistent bedtimes, creating a comfortable sleep environment, limiting caffeine and alcohol, and addressing sleep disorders can improve both sleep quality and pain levels. Nutritional approaches may also play a role in managing chronic pain and inflammation. Foods rich in omega-3 fatty acids, like fatty fish, walnuts, and flax seeds, have natural anti-inflammatory properties. Antioxidant-rich fruits and vegetables can help combat oxidative stress that contributes to inflammation. Some people find that certain dietary supplements, like turmeric, glucosamine, or fish oil, provide modest pain relief, though it's important to discuss any supplements with your healthcare provider to avoid interactions with other medications. The importance of working with healthcare providers who understand pain management complexity in seniors cannot be overstated. A comprehensive approach might involve collaboration between your primary care physician, specialists, physical therapists, and other healthcare professionals. When discussing pain management with your healthcare providers, be specific about your symptoms and treatment goals. Rather than simply saying, "I have pain," explain how it affects your daily activities, sleep, and quality of life. This helps providers develop more targeted treatment strategies. Be honest about medication use and concerns. If you're worried about hearing loss from NSAIDs, express those concerns directly. Ask about alternatives or combination strategies that might allow lower doses of potentially problematic medications. The economic and social impacts of hearing loss extend beyond individual consequences. Untreated hearing loss can lead to increased healthcare costs and affect family relationships. When someone develops hearing difficulties, family members often need to adjust their communication patterns and may take on additional responsibilities. Preventing hearing loss through informed medication choices can help preserve independence and reduce family stress. I want to address a common misconception. While some hearing change is common with aging, significant hearing loss is not inevitable. Age-related hearing loss develops gradually, while medication-induced hearing loss can develop more rapidly and is completely preventable. Research continues to evolve in this area, with new studies regularly adding to our understanding of medication-related hearing risks. Scientists are also working on regenerative medicine approaches that may eventually help treat hearing loss, though these treatments are still experimental. However, prevention remains the best approach. Be cautious about unproven treatments that claim to restore hearing, and always consult with qualified healthcare providers before trying new treatments. For those who do develop hearing loss, whether from medications or other causes, early intervention with appropriate hearing aids or other assistive devices can make an enormous difference in outcomes. Modern hearing aids have advanced dramatically, with features that can significantly improve hearing in various environments. I want to emphasize that I'm not suggesting people should never use NSAIDs or that they don't have important medical benefits. For many conditions, these medications can provide significant pain relief and improve quality of life. The key is using them wisely, understanding the risks, exploring alternatives when appropriate, and monitoring for potential side effects, including hearing problems. What frustrates me as a physician is how often I see patients who develop preventable hearing loss because they weren't informed about these risks, or because the connection between their medications and their hearing problems wasn't recognized. Frank, the patient I mentioned at the beginning, still struggles with hearing loss despite stopping ibuprofen over a year ago. His hearing aids help, but he'll never recover the natural hearing he lost during those 3 years of daily NSAID use. If you're currently using ibuprofen, naproxen, aspirin, or other NSAIDs regularly, please don't ignore this information. Talk to your healthcare provider about your individual situation, explore alternatives if appropriate, and pay attention to your hearing. What seems like a minor inconvenience now, needing to turn up the TV or ask people to repeat themselves, could be an early warning sign of permanent damage. Your hearing is precious, and once it's damaged by medications, it's generally gone forever. The temporary pain relief provided by NSAIDs may not be worth the permanent loss of one of your most important senses. Make informed decisions, advocate for your health, And remember that preventing hearing loss is always better than trying to treat it after the damage is done. Thank you for watching, and remember that your health decisions today will impact your quality of life for years to come. Don't let a common painkiller steal your ability to hear the voices of your loved ones, your favorite music, or the sounds of the world around you. Until next time, this is Dr. Harrington reminding you to protect your hearing and make informed choices about your medications.